The history of meningitis. Meningitis is a disease caused by the inflammation of the protective membranes covering the brain and spinal cord, known as the meninges. The inflammation is usually caused by an infection of the fluid surrounding the brain and spinal cord. Meningitis may develop in response to a number of causes, usually bacteria or viruses, but can also be caused by physical injury, cancer, or certain drugs. The severity of illness and the treatment differ depending on the cause. Thus, it is important to know the specific cause of meningitis. In 1805, the first outbreak of meningococcal meningitis was recorded in Geneva. Meningitis was mentioned as early as Hippocrates, but he did not know what it was. Earlier physicians described patients with an inflammation of the meninges with a continual fever. There are 5 types of meningitis: bacterial, viral, fungal, parasitic, and non-infectious. Bacterial meningitis can cause life-threatening infections that need immediate medical attention. Viral meningitis is serious but less severe than bacterial meningitis, and people with normal immune systems usually get better on their own. Fungal meningitis is acquired by inhaling fungal spores from the environment. People with medical conditions such as cancer, diabetes, or HIV are at a higher risk of fungal meningitis. Parasitic meningitis is caused by parasites in contaminated food, water, and soil, and is less common in developed countries. Non-infectious meningitis is not spread from person to person. It is caused by cancers, certain drugs, head injury, lupus, and brain surgery. Successful treatment began with the introduction of serum therapy for meningococcal meningitis in the 19th century. Antibiotic therapy began in the 20th century with the use of sulfonamides by Francois Schoentker and penicillin by Chester Kiefer. In 1906, researchers noted that horses could be used to create antibodies against meningococcal bacteria. American scientist Simon Flexner further developed this technique, and mortality rates then decreased from the meningococcal disease.
How is meningitis transmitted?
Meningitis is transmitted by germs that are exchanged via mucus excretions from the respiratory system and the throat. For example, saliva, mucus, and kissing another person or sharing drinks. So it is not spread by casual contact or by breathing in air where an infected person has been. And other meningitis-causing bacteria, because it's a secondary infection, are not spread person to person, but can cause the disease if you are immunocompromised, such as having a weakened immune system or head trauma. An example of this would be if you have HIV, you're much more likely to get meningitis than someone who is not, or someone who is on immunosuppressants if they had an organ transplant. People that are around an infected person are given preventative antibiotics in order to stop the spread of meningitis. Although if meningitis is caused by a secondary infection because of being immunocompromised, the people around them do not need preventative antibiotics. Healthy people can carry the bacteria in their regular bacterial flora without getting sick, in their nose or their throat, which is where their mucous membranes are. This bacteria rarely invades the body, causing disease. Most people that are carriers tend to not become infected, and it mainly affects university students because of close quarters and lots of drink sharing and obviously making out of the bill. There are many different species of meningitis, and they are Neisseria meningitidis, which is meningococcus, and that's the one that affected Acadia, Streptococcus pneumoniae, which is pneumococcus, and Haemophilus influenzae type B, which is HIV.
What are symptoms of meningitis?
Symptoms occur 3 to 7 days after exposure and can include nausea, vomiting, fever, rash, headache, stiff neck, sensitivity to light, and altered mental state such as confusion.
How does meningitis invade the immune system?
The lining of the brain is an immune privileged site, which means there is no immune response when meningitis infects it. There are no immune cells in the brain lining to defend the body. Therefore, the response is repressed. There is no phagocytosis, so there is no killing of the bacteria. The antibodies that get rid of the bacteria cannot pass the blood-brain barrier, therefore there is no response. This makes meningitis very hard to get rid of because it is allowed to grow at a normal rate. Therefore, the brain cannot control it. There is no inflammatory response, no phagocytosis, and no cytokine production, which means no action to get rid of the invader.
How is meningitis cured or prevented?
Meningitis is cured by antibiotics, although they are difficult to use because they cannot pass the blood-brain barrier. So there's also prevention, which there are vaccines used against Neisseria. So ways to prevent it are don't be around sick or infected people, don't share drinks, don't make out with strangers at the Ville, wash your hands lots. So the vaccine that was used at Acadia was meningococcal B vaccine, Bexsero, and it was used against the species Neisseria. The vaccine is a recombinant vaccine, and this vaccine injects a recombinant surface antigen, which is a type of the DNA from meningitis, into your body. So the genes for the surface antigen of meningococcal B are inserted into yeast cells, and they're cloned, and the yeast cells are grown in large fermenters, and the recombinant surface antigen accumulates all in the yeast cells, and then these cells are disrupted, and the antigen that was made by all of them are used, and that's what's put in you as a vaccine. This allows for your immune system to identify meningitis when it comes into your body, and it allows it to have the proper defense against it so that you don't get infected. Therefore, the antigen stimulates an immune response from the body, and the body then knows how to defend itself properly against this antigen, as well as how to identify the pathogen, which is meningococcal B, and defend against it specifically. This provides your immune system with memory and protective immunity. So whenever this type of bacteria comes and tries to infect you, it has memory on how to defend itself, and you no longer get infected with it. There's all kinds of different vaccines for all this specific species.
Surprising things!
There are surprising things about meningitis. It chooses to infect a host, but then it goes to the wrong part of the body because it's not able to transmit to another host, which is what all parasites want to do. So it goes up to your brain, but when it kills its host, it can no longer transfer it to another person, so it can't reproduce it anyway. So it makes a mistake to go to the brain. So if it were to ever change and alter its DNA and be able to survive and go in the rest of your body and transmit easier, we'd have an epidemic on our hands. But at the moment, it's just a really dumb parasite. It doesn't know what it's doing, and it's really bad at spreading. So that's what's surprising about it. It doesn't have a good propagation strategy. It can't spread to other people, and it's just dumb. And that's about it.
What was the impact meningitis had on Acadia University last year?
When meningitis affected the Acadia campus, clinics were offered for students and staff to receive both doses of the vaccine provided by public health. Meal Hall changed the sanitization process in food prep. Counselors on campus offered and encouraged students to participate in counseling, especially for those who knew Sarah Hastings, the student that passed away of meningitis. Public health officials were stationed around campus for any questions, as well as numerous posters hung around campus advertising clean living ways to reduce risk of infection.